and Dr. Ambedkar's work, and how we envision Dr. Ambedkar in that particular sphere. In this entire month, we are trying to call distinguished scholars in this particular field to share their visions and their work. So today we have Dr. Pankaj Vaidya. As I said, he is a distinguished researcher in pediatrics and also a professor at PGIMER Chandigarh. His topic is revisiting Dr. Babasaheb Ambedkar and health. And in particular, he is going to talk about JaiBhim Health initiative, which he began when he started working in Chandigarh in PGIMER. Sorry for my mispronunciation. So he's going to tell us more about that. Pankaj, over to you.
Thank you. Thank you, Dr. Prashit. Uh, Many of you must not be knowing that he is also a doctor and he is also an astute researcher. And in fact, I look forward to collaborate with him, which we have
Sure.
not been able to do so far. But today we are here on this platform for something different. And at the outset, uh, I can see that Bhante Siddhi Ratan is there in the meeting. So I would like to begin with my Trivar Naman to Bhante ji. Vandami Bhante ji. Very thankful to Bhante ji for his discourse. It was very enlightening. In fact, I have heard this discourse for the first time. It was very helpful. Thank you, Bhante ji. Uh, the next thing which I would like to do here is that I would like to thank the ANA platform and also Dr. Prashit Ambade for inviting me for this. Uh, and it is very kind of him to have thought that on such a platform we should be discussing about health, and that also health of our people, and more so what was Baba Saheb's vision about this entire arena or field. So not wasting much of my time and much of your time as well, I want to come to the topic. And as Dr. Prashit told me that the audience is some, I think some researchers and doctors have also joined, but the general audience is there. So I've tried to make my presentation very crisp and very easily understandable. And in fact, I being a child doctor, have also tried to make it a bit child friendly with a lot of images of Baba Saheb. Baba Saheb and what we are planning to do. So, Dr. Prashit, can you please confirm if you are able to see my presentation?
Yes, we can. We can.
Yeah,
Thank you.
thank you. So, friends, this is something which I came across not a very long time back, and I was going through Baba Saheb's volumes and speeches and came across some articles in the press also, wherein I could figure out that Baba Saheb has contributed to India's health system a lot. Then, out of my inquisitiveness, I went into the details wherein I could see that he is one of the staunch figures who has promoted for health and has spoken very vocally and very loud about health. Now, just to understand why are we talking all this in on this forum. So, in short, it was very close to Baba Saheb's heart. Uh, Health and education, as we read Baba Saheb, length and breadth, we understand that these were the two topics which were very close to Baba Saheb's heart. We can understand from the kind of intellectual articles and various texts that he has presented with. So, just with a idea of making people aware about Baba Saheb's contribution about health. I created this PPT wherein I try to make both doctors, that is medical people, the uh, the
चलो कोई
healthcare
नहीं, एक पे पैसा
workers
बच्चे को दे दियो,
also, those who are
एक पे
involved
पैसा
in
बच्चे को दे दियो, देना होता है।
providing health, and also the common people, the lay people, to make them understand why these things are important for us, especially. So it would be really difficult to go into the details in a short time that I have been allotted today. But I would try to do my best to make you people aware about what is the idea. I am a pediatrician. I am a researcher. I am a professor of children's health here at PGI Chandigarh, which is a institute of national importance. But I would like also to take this opportunity to tell you that whatever I am going to say today is on behalf of my team. So as you can see in the back, so this is our team called the JaiBhim Health Team, and one of my very close collaborator, Dr. Navneet Kishore, who is a consultant in the WHO, World Health Organization, is also here in the meeting in case any one of you wants to get in touch with him. And of course, if you want, he may also address your doubts. At the outset, I thank him for the conception along with me, and also to Dr. Prashit Ambade, who has been a good friend and a inspiration behind continuing with these activities. It would be no to uh, exaggeration to say that Baba Saheb's contribution to health, not just for India, but as an idea, as a concept, is phenomenal. So, what I believe is it would be difficult to cover everything in just 25-30 minutes. But of course, today we can discuss his food policy, his labor policy, his broader approach to the government's role in health interventions. And to start with, I think there would be no better example than to talk about the Chaudhar Talab Satyagraha, which Baba Saheb did, and with a lot of meticulous planning. Uh, you must be knowing that at Mahad, it is just a population of 7-8 thousand at that time it was, and only about 500 people of our community, the so-called Mahars, were there.
Pankaj, sorry to
Huh?
interrupt. We cannot see
Yeah.
your slides are forwarding. So can you,
Okay, should I go back and again
means we
restart my
cannot,
presentation?
we are able to see only the first, first slide of yours. So maybe,
Right, 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 right.
yeah,
And
let's try
sorry,
to
how
reshare
about
it.
now?
Right now we cannot see anything.
Okay, okay. And now?
I guess it's slowly coming up. Let's see. Yes, but we
Yeah,
can
yeah.
see. Yeah.
Sorry.
Can you try to scroll down? So just to check,
Yeah, sure, sure.
okay, there you
Is
go.
that
Okay,
okay?
great.
Yeah,
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 now
yeah.
we can see.
I apologize for that. Maybe there was
No worries.
some glitch from my end.
No worries.
But
No.
of course, we were on the Chaudhar Talab Satyagraha, which Baba Sahib did. And as I told that to many people, it sounds as if it was like a small event, but to my mind, it was a symbolic event which has changed the course of history, not just in our country, but all over the world. So, on the left, you see an image wherein Baba Sahib is picking up a handful of water and drinking it. And on the right side of my presentation slide, you can see this is the court judgment of the Bombay High Court, uh, 20th March 1927, when Baba Sahib drank that handful of water. And this is 1937 court judgment, wherein Baba Sahib won the case after fighting it for 10 years. So those 10 years are defining for we the people, because we are the people who had to fight uh, not just for our rights, but our right to as basic as drinking water. And each one of us should never forget it. There would not be another leader I think, in the entire world, in the history of the entire world, who has fought for water for his people. So, with that, you can understand what stature Baba Saheb has for us. Of course, all of you are intellectual and you know, but clean, safe drinking water. Uh, so many organizations, they talk loftily about several things, and one thing which is not available to almost, say, one fifth of India's population. For that, Baba Saheb fought. So, to me, he's the greatest health physician one can ever find in the history. And from that level, wherein he brought us the right to drink water, uh, to contributing to water resources development of the entire country. So there is a document of almost 450 pages which is available on Google as a PDF free of cost, prepared by the Central Water Commission, uh, which has written about Baba Saheb's contribution in water resource development of the entire country. See the kind of tribute the man wants to give uh, to be as basic a need as water, which is like defining the health. And of course, say 65 years later, the Department of Post, Government of India is honoring Baba Saheb's Chaudhar Talab event by commemorating a stamp in his honor. So, just to make you understand the magnitude of this, and of course, in short, if we want to say in this short period of time, and for kids to understand what was Baba Saheb's vision, it was as simple as we can say democratizing health and education. For that, we will have to understand what does democratization mean, what does democracy mean. And of course, as we understand Baba Saheb, as we read about Baba Saheb, as we listen about Baba Saheb, as we analyze Baba Saheb, we come to know each and every day what democracy meant for him. So Baba Saheb's ideas of social security and public health were to ensure the overall well-being of the masses. The public goods such as health and education were his major focus, and he always wanted an inclusive and equitable healthcare system, seeking an equal distribution and access for all to this system. And that is why he always believed in democracy. That is, if we want to understand in simple or short way, something which is for the people, of the people, by the people. So he is well known as one of the most prolific advocates of public policy, and uh, at least I could see from his almost 20 books, countless speeches, and newspaper articles that he had figured out that there was serious lack of food security, labor security, a feeble healthcare system at the time in India, and there was government's apathy towards the poor and the marginalized. And why are we talking all this? Because his prescient critic is true even today. So I would take you to the context wherein we will be able to understand why we are talking about Baba Saheb in today's era related to health. So during his various tenures in the government, uh, he enacted uh, several a range of welfare policies about health, which I will let you know very soon. Of course, Baba Saheb's idea of the government's role in public health is something very peculiar to look at. So, if we want to understand in simple language, so I have framed it here that his vision was not disease centric. Health should not be disease centric. Rather, it should be to improve the social determinants of health, that is, lack of which will cause ill health. So one can say that he never wanted anybody to become ill. So prevention was the major tool by which you can prevent care and exuberant expenses which we do on health. How can we provide that? By providing nutritious food, stable income, access to clean drinking water, removal of caste and class inequalities in the access of healthcare, So everything we will not be able to cover, but of course, just taking an example of food security. So these are Baba Saheb's words. He did not. He said that food security is not an end in itself, but a tool to end caste-based equality. See his vision. He used to think that to end caste-based inequality, one would have to focus on food security, which is directly related to a community's health. Then he also said inequality in itself worsens the public health capacities of a nation. So, a nation which was not ready to count us into its mainstream, about which, about that, Baba Sahib says that we are an integral component. Just to give you a glimpse of his work, in 1942, when he was member for labor in the Viceroy's Executive Council, which means the cabinet of the government of British India, he formalized and executed the food security policies, universalized the subsidized grain for workers. He ensured that workers were members of these boards. He conceptualized and materialized central food advisory committees for each state. He also envisioned free labor canteens in every industrial clusters. So in today's world, all of these things would look like, oh, ye to hona hi chahiye. But at the time, it was not like that. He argued for a robust system of labor security, which was essential for the growth of public health. See how Baba Sahib was relating labor security with public health. So he even defined what were the role of the state. So to ensure safe working conditions, fair wages, employment protection for the workers, maintenance of a healthy workforce, life insurance schemes for them, and during his various tenures, which will not go into details, he actually made many labor reforms which are followed even today. 8 hours work day in India is because of him. DNS allowance, labor welfare funds, revisions of pay scales for employees, leave benefits for worker, a minimum wage, all of these are like conceptually Baba Saheb's ideas. And for workers, he formed the first employee state insurance and social security and health insurance schemes, uh, kind of mm, for the workers first time in the country. uh, Women, he was very passionate about working for women, and that also reflects in the health sector. So I don't know if many of you know that a range of laws protecting female workers, including like the Women and Child Labor Protection Act, is his brainchild. Maternity Benefit Act, Mines Maternity Benefits Act, Women Labor Welfare Funds to safeguard health and safety of working women are actually his ideas. He also created and passed the Indian Trade Union Amendment Bill of 1943, legal framework for strikes, which most of them are still being used in the format which Baba Sahib produced. Why we are discussing all this? Because this is one pandemic, COVID-19, which jolted the entire world, and in India it had its kind of entry in March 2020, wherein pre-existing societal divisions affected the most the migrant workers and the marginalized communities. It was a struggle for farmers, scheduled castes, scheduled tribes communities, women, and religious minorities. So, whose responsibility was it to ensure equipment, manpower, slow the spread, providing food security, labor security, social security, public health, and protecting the marginalized? So, how the country could have been better prepared to deal with a disease of this scale? So, all the answers lie in Baba Saheb's vision and his plan for public health that we had discussed in a nutshell just before some time. And after 78 years later, we find that Baba Saheb's vision is the one which can take us into that golden kind of Prabuddha Bharat which Baba Saheb believes that our country should walk into. Of course, I have a lot of statistics, but according to the audience, I would not like to go into it. It was like one of the darkest phase of the country, wherein a lot of people suffered, and a lot of people had to kind of their lives were destroyed actually. So I would not go into those details. All of you know, but of course, like Baba Saheb's predictions came out to be very true, that caste mattered at this time also. And you would see that instead of helping the workers, there were laws which were coming up. Especially, I have just commented upon these two in my slides, wherein these were laws kind of to harm them actually. So, just to make you feel how Baba Saheb used to speak about this, and see the courage with which he spoke in November 1945 at the 7th Indian Labour Conference, he said that Labour may well ask statesmen to say how many houseless persons could have been decently housed, how many naked persons could have been properly clothed, how many hungry men and women could have been given full nourishment, how many uneducated persons could have been educated, how many sick persons could have been restored to health if the money spent on war had been spent on public welfare. So that is why Baba Sahib advocated increase to the access of subsidized food, clean water, safe and fair employment and housing, better funding into the medical system. And this astonishing 1938 statement of Baba Sahib in the Bombay legislature, while he was making some statement about public health infrastructure, is kind of mind boggling. He made some calculations, he presented in front of the Bombay Legislative Assembly, and said that it works out that the total expenditure for health, for public health, for the Bombay province turns out to be 25%. On the contrary, even today, the entire country is not spending more than 2% of its GDP on healthcare. So, can you see what the health gap is? Even countries as backward as Afghanistan or as developing as Brazil are spending something like 10% of their GDP on health. And we are sitting on a meager 1%, 2%, 2.5, 2.4% every year, you can see. So, not going into much more detail, so we thought that this COVID has jolted us. We need to now come into action, and therefore we like-minded people came together to conceptualize JBH, which we call it as JaiBhim Health, and inaugurated this on Baba Saheb's very birth anniversary. So, what is this all about JaiBhim Health? About to talk about which Dr. Prashit Ambade has invited me here. So, just to give a glimpse of it, that to start with, first we all should understand what is actually health. So, what is the definition of health? WHO says that health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So sometimes I believe that this definition is also derived from Baba Saheb's thoughts, or probably in resonance with Baba Saheb's thoughts. Buddha always used to say that know the sickness, abandon the cause of the sickness, aspire the cure, and rely upon the medical treatment. Not to go very far, but this inequality report of 2021 says that in India, the socio-economically marginalized communities are the ones who suffer most from ill health. And of course, there is a lot of data to show that general category people fare much more well than OBCs, and SCs more than uh, and better than, and they fare better than scheduled castes, and also better than scheduled tribes. So I will not go into those details, but even at individual level, if you just have a look at this graph, you can see that even countries like Russia, how many number of hospital beds are there per thousand population, And in India, you can see how meager it is, just 0.5% in comparison to Russia, which is 7%. So I will not go into much of the statistics, but of course, considering the above things, we just came together locally with Baba Saheb's inspiration that act locally and think globally. So we in Chandigarh we call it as Tri-City, like Chandigarh, Panchkula, Mohali. These areas are called as Tri-City. We brought all the healthcare providers, the uh, including the doctors from any stream, the nurses, pharmacists, technicians, A&M, all healthcare providers, ASHA field workers, scientists, research fellows, students, social activists, and brought them on one platform, and we call it JaiBhim Health of the Tri-City. So our preamble is democratizing health. Our philosophy is that of our great leaders, including Dr. Babasaheb Ambedkar. We have certain objectives like identifying top health concerns of the society, addressing the resource gaps, working together for preventive and lifestyle health care, providing social support, awareness, counseling to unite and organize Ambedkarite healthcare providers to the goal of universal healthcare and to complement the Ambedkarite mission. And the expected achievements that we are planning is better health of the society, develop a rational scientific thinking of the society, building a network of scientists and activists, and to protect and promote human dignity and pride of the society, such that we are able to think about our people, about whom no one else is going to think, as far as I understand. So, just to tell you that it doesn't matter how many resources you have, if you don't know how to use them, it will never be enough. So, with that, we want to go in small steps and not leap very large steps, but small steps at a time. And we hope that we'll reach up the ladder very soon. So, we are like non political, democratic, inclusive, non critical, action oriented organization. So, this is our vision. This is kind of based on Baba Saheb's principles. We are working together for bringing equality, social justice to health. And gradually, we are trying to pull in and bring in more Ambedkarites into, and with a vision to pay back to society and also generate scientific temper in our people, making them aware about their own health. So our expectations from the society are that we should join hands together, come out, take stand, be vocal, and of course spare some time for social activities. All of us are doing this voluntarily, and we are not getting paid for this, but we think and take this as a responsibility. That is why we do it. The way forward is that networking is the first primary thing. Bringing coming together is a beginning, staying together is progress, and working together is success. Of course, every small nut and bolt in this machinery matters, so no one is less than the other. We plan to organize health camps for ensuring health talks for health awareness, and of course, this we call as RAPP. Dr. Prashit is also part of our team, wherein we envision to do research, publication, then advocacy, and of course, just like Baba Saheb, then bring it into policy. We work at three level: local level by creating local JBH groups to create awareness about health. Regionally, we are planning to create an app about the same. And nationally, of course, we are envisioned to work on research, advocacy, policy, and publication. The task is tough, uphill, but we are on it, and someone has to do it. We will pitch in, and we expect all of you also join hands with us. With that, I would like to end, but none the least, we should not forget Baba Saheb's vision and these take-home messages, which are based on his policies, which is required now more than ever. His broader idea of social security, we all have to make it feel to everyone that healthcare should be a fundamental part of the human rights. Governments must provide health insurance to all its citizens, like a universal public policy, especially for those below poverty line. They should be the first beneficiaries of the insurance. No one should be left out. Money should not be the reason they lack the health care they deserve. And of course, caste and caste caste and class distribution should not also determine this, rather not any kind of discrimination. And government should be held accountable and answerable to the public. This sort of basic social security should be non-negotiable in a democracy. And with a small effort, at least at a local level, we go to places and make doctors aware to start such initiatives. And of course, we find many healthcare providers also who can who pitch in and also are important force. So thank you so much for the time and patient listening. Thank you, everyone. Thank you, Anna. Thank you, Dr. Prashit.
Yeah, thank you, Pankaj ji, for that wonderful talk. Um, I would like to bring Dr. Navneet, before we take some questions. And Dr. Navneet, if you can hear us, I would like to ask you if you can give us a particular, a specific examples, if you can remember from your ongoing work with this initiative, which you would like to, share with us. What were the, kind of a message you got from community? What was the few peculiar things you realized when you were working on that particular initiative? In a brief, maybe, explain us one particular initiative you took recently under this, and what were the learnings?
Yeah, thank you everyone for this wonderful meeting. Uh, Actually, we started this initiative, and after initiating this, we are doing certain activities like we are also educating school students and other common people at community level about their health issues. And we came to know that our people are the most vulnerable to these health issues because poverty, lack of education, and so many factors are there. We all know. And while working with them, we need that. We came to know that education is simultaneously a big concern for the society. We can educate them because by educating them, they can prevent so many infections. They can adopt healthy lifestyle. So this is the key concern area we need to work upon. And this is not the sole task uh, we are facing. Actually, we are working to achieve a goal of making a cashless and classless society, which Dr. Pankaj emphasized in our work. And we are working in that direction. We are just a small latent bolt in that direction because healthy society only can give a healthy people. And if there is a discrimination in the society, like discrimination based on the caste and the classes, then we cannot achieve a healthy society. So it is important to each and every working area, whether anyone is working in art, in science, in music, and all, or and even in engineering. Also, any area you are working upon, each and every act should go or should culminate to a casteless and classless society, and to provide equal opportunity for all. This is the main idea we came to know that without achieving that goal, we cannot uh, make a sustainable change in the society.
Yeah.
So that's all from my side.
Okay, thank you. Thank you, Dr. Navneet ji, for that insights. So if anybody has questions for either Dr. Pankaj or Dr. Navneet, please raise your hands and I will take it. Or maybe you can, type in chat as well. Before one small thing I would definitely like to mention before we go to the questions is Dr. Pankaj mentioned about social determinants of health. And WHO started promoting this idea in late 2000s, okay, around 2000 or something. And you can see WHO took so many years to realize health is not only impacted by provision of doctors, nurses, or hospitals. Health is impacted by everything else happening in society, and it took so many years for them to realize that. But Dr. Ambedkar already was aware of these things, and without social emancipation of our people, it couldn't be achieved in terms of health for our people. And that was his main argument, was when he was making those public policies uh, back in those days. So in today's context, in public health context, I would call Dr. Ambedkar as a social determinants of health champion, maybe the first one from India from that time period. So with that note, I would like to take a few questions, and I will go with first Mahendra ji and then Satynath ji. Okay. Um, Keep your question very brief, so we have enough time for others as well. Mahendra ji, you go first. Mahendra ji, can you hear us?
Hello, JaiBhim, can you hear me?
Yes, we can. Yeah, go ahead.
All right, JaiBhim. Thank you, Dr. Pankaj. Very informative and deeper, very illustrative. Definitely would like to have your presentation, study, and soak in a little more. And in the work, what you guys are doing is kind of help. I would like to kind of, I'm sure that you are aware, probably, I would like to kind of pick your brains on a couple of topics that again. Endogamy has been a major problem all over in Indian societies, and that is it's even more aggressively practiced in our community. That has got such a huge impact in kind of reducing our gene pool, and kind of all the recessive genes are getting passed on again and again. And that sometimes we are all the more vulnerable to certain hereditary or genetic diseases, like heart or diabetes or any kind of ailment or maybe mental problems. And I was kind of reading about it and found out that in India today, around 16% of the endogamy or within the relatives marriages are happening in Muslim population. And next to them, uh, it's new to look at only ones are kind of practicing that practice wherein marriages are happening within relatives. We call it as a kind of secondary relative, but it's still very harmful for the family being. I would like to hear more from a qualified person like yourself on this topic, and probably we need to kind of spread word and awareness among our society so that again we can discourage people from following this practice.
Okay. Thank you, Mahendra ji. I guess your voice was breaking in between, but I will summarize if and you can let us know in chat if I got your questions wrong. I think you were asking about endogamy and how it has impacted health in overall, especially for our people, and what can be done on that front. And if you have any other views, Pankaj ji. Pankaj ji, if you would like to respond to that.
Yeah. Thank you, Mahendra ji, for that question. I'm very happy that people have got intrigued into this and are interested to know more. So, of course, these are things which will come only by health awareness. So, you see, I am a clinician, I am a pediatrician, I look after patients, but I'm very much interested in public policy. And Dr. Navneet is himself a public policy expert, public health expert. And Dr. Prashit also works on this. So, in short, I can say from a medical point of view, there are two concerns. As you said, that when certain diseases like which are autosomal recessive, and two persons marry, so there is a risk of getting transmitted. So it's not with all kind of genes that happens, but there are certain specific diseases with which this happens. And especially if we look at our community, so you must be knowing that sickle cell is one common thing which happens in our community. So in fact, it's important to create that awareness, and just to let you know, see at what level we have to work. These There is a community called Sindhi community, so they organize their healthcare camps every places now and then, wherein they screen their population for uh, thalassemia, which is a common condition in their community. And that is how they create awareness, and also uh, uh, test their people to see that whether there are those genes, and then those who are having those recessive genes, they counsel them that they should not get married together. So your question is quite valid, and I think hope I have been able to answer your question.
Yeah. So
We can take Satynath's
yeah,
question.
Satynathji, go ahead.
Yeah. First of all, let me congratulate Dr. Vaidya for such a wonderful presentation. His slide collection is also really fantastic. I hope he has put them in a blog, or would like to make podcasts. It should be widely really available for people. I have a couple of doctors who are my relative, and I would love to direct them to your blog if you have. And secondly, I want to know from, since you have researched on Dr. Ambedkar's contribution during those time he was a labor minister, I understand. Was he labor minister for all the time that he was in the government, British government, or was he also health minister or something? Even as though as a labor minister, he could include so many things, so many aspects of it. I would love to see all his contributions during that period of time collected and published. If you know, you could that it has already been published. I'm not sure if it is there in one of his volumes. Many of his thoughts are very spread out in several volumes, not collected together. So everything that he proposed and did during the British, during the time, he was a minister, he was, I guess, secretary in the British government. Probably he was called secretary, I don't know. And what period was he in? I'm very clear about it. When did he join, and when did that period end? So all of these things, if you could shed some light, I would love to hear. Thank you.
Yeah, go ahead.
Thank you, sir. Yeah, thank you, sir, for that lovely appreciation. It's encouraging. So far, sir, we don't have a blog, but of course, that's a good idea. And in fact, we envision to put it up all as a website, but yet we have not been able to kind of consolidate those resources which are required. But we will soon plan to do it. Regarding the question you had asked, so of course Baba Saheb's contribution is immense. How it has been related to health, I have shown you just a glimpse of it. So there is a lot of literature and lot of material available uh, at multiple places, and there are only a few books that I could review. You would be surprised to know that in the volume 2 itself, there are many anecdotes which are mentioned in the volume 2 of Baba Saheb's volumes and speeches, which originally has been published by the Maharashtra government. And it also has a draft of his Bombay Legislative Assembly debates, wherein he got the family and health, health and family welfare uh, department kind of bill approved in this assembly at Bombay province while he was a minister there. And the national Ministry of Health and Family Welfare draft is actually based on this original draft of the Bombay province. So it would not be an exaggeration to say that the India's family and health and family welfare ministry and its draft has been created based on Baba Saheb's work. So that is one thing which every one of us would feel proud about. In fact, the calculations which he did for contraceptions have been originally retained into this draft. So it is like a great contribution. And as you asked regarding the exact durations while he was a minister, so I uphand don't remember it. People who actually work in this area would be able to answer, but as far as I remembered, it is well documented in all his biographies, including the one by Shri Dhananjay Kir, or the one by Khobragade Saheb, or by uh, anyone you can pick up. So what I took up was the ones which were relevant to health. And in 1943, he was one of the labor members in the Viceroy's Council. And of course, later on, when he went on to become member of many committees, and of course, while being the law minister, he was able to enact many laws and bills with his perseverance and his persuasion to other departments as well. So maybe when I find time, I can go into those details and prepare a draft of it, and maybe this can also be put up whenever we are ready to go ahead with our website. And thank you for those suggestions. I appreciate.
Share your email.
Yeah,
Email.
Pankaj,
Yes, sir. Sure. I would do that in the chat box right away.
Yeah. Thank you. Thank you. Do we have any other questions? So,
Prashit, this is Mahesh. Again, Pankaj,
Yeah.
thank you for joining. It was a very nice session, and you're talking about the healthcare. That is the prime, what you call in America, it is a prime industry, you can say. It's a very business-oriented industry here. But in India, it's also getting commercialized healthcare. It's very commercialized, right? No one wants to go to the doctor's place. And in this scenario, you started the JaiBhim Health. So looks like this is a non-profit, right? So what is your healthcare, what do you call, the promotions or are you charging the people or how that goes?
Okay. That's a very pertinent question, and probably that was one of the reservations I had while saying yes to Dr. Prashit in joining you today, because this is so far we are not very much into the doing mode. So it's an idea, it's a concept, and for every stream of this, a lot of resources are required, including manpower, funds, and of course other cooperation from other people and ideas, and that is how it needs to be taken ahead, which I believe. So we have small groups here in the Tri-City, and we try to go to the peripheries and take health awareness talks, and we are planning to do small camps. But I think from my side for now, my main focus is on networking and getting people to understand this and start doing it locally. So I'm happy to share that even before we floated this idea, there is an organization called Baho Nagpur, which is called Baba Saheb Ambedkar Health Organization at Nagpur. They are they are already doing a phenomenal work locally at Nagpur in the surrounding area, and but there are certain limitations they have, and we have tried to cover up those limitations. For example, a small bit which I observed was that it's just a doctors focused group, but in our group we don't focus just on doctors, but on all healthcare providers, including the researchers. And the other thing which Dr. Prashit also knows, that being academicians, we actually want to work more on the research part of it, and like preparing articles, putting it into the intellectual arena, publishing it, and then doing advocacy and policy. So as our resources will go on increasing, we will expand our work. That is my vision. So, but I appreciate your concern, and thank you for that question. I hope I have been able to satisfactorily answer.
Thank you.
Vivek ji.
Yeah, hello, JaiBhim, Dr. Pankaj. It's a very informative session, and the research work that you are working on, and it's a wonderful presentation as well. So you are out. You are based in Chandigarh, I believe. This is what I understand. And this JaiBhim Health that you created, is this also emphasizing on policy making? Suggesting the government in Haryana, that is, I believe, Chandigarh or Punjab, suggesting the policy making changes so that the our population, which is neglected in the healthcare arena, where it can benefit and uplift their quality of life. Is that something that you are also working on?
Yes, sir, very right. And that is our ultimate goal, to kind of do advocacy. But in health sector, when you want to do advocacy, you have to have some data, and by means of original research, the kind of Prashit actually is an expert on this. Dr. Prashit is an expert on this. But Prashit, you may please add on. At my level, what we are trying to do is we are first trying to bring the right kind of people together. So it needs some kind of original research, and the data which is available from the government sides is not so kind of broad. So we have to focus on the problems which our people face. We want to do that. So for that, we will have to do some kind of original research. I think Prashit will be able to tell you more. And then comes the stage wherein you have to publish this into standard journals. I think that is how our medical field and health field is. Once we publish it, then we can go ahead with advocacy. Advocacy is that we can advise the governments or the responsible bodies or the ministries who kind of would take actions or steps based on our recommendations. So it has to be backed with data. And finally, then only a policy change would come into kind of existence or force. So with that, I would request Dr. Prashit to
Yeah, no worries. Yeah, Dr. Pankaj, thank you so much. And Vivek ji, to answer your question, uh, for Dr. Pankaj's work, it's just um, uh, taking a flight, so they are just increasing their reach, and I believe they haven't reached to that level where they can influence policies at state level. But the idea is to uh, such forums actually connect with many more folks who can contribute this knowledge generation related to public health field, and then we can argue for maybe better policies, and we can come up with some solutions for our community. For example, just Mahendra ji brought it a very interesting research question about endogamy and how it is affecting different disease prevalence in our community. So the researchers like us, our job is to look into that, maybe find some evidence, and then, based on whatever resources are available, maybe, come up with some new interventions, and then maybe reach out to policymakers. Me and myself and other folks who do this job, we have done this in past, and we continue to do that. And I will request, to you folks, whenever you go in community, if you find anything, troublesome health related challenge, please, you, uh, let us know, so we can, think about it, and maybe come up with a scientific way to tackle that problem, and, make our case. That's the whole purpose. I hope we both were able to answer your question, Vivekji.
Yeah, no, that is fine. I understand, we all from India, we all have certain understanding the community structure, as our population is becoming educated, and getting in the policies and the research, and we're talking about all lot of things, so we just wanted to see how our researchers, also putting this research into the public domain to make a policies to benefit our community. Because unless and until the numbers are there, I think the government is not taking the cognizant about how our, how can they bring the policy changes. So I think, the researchers, the people like you are, have that keen interest in doing so. I think definitely would have something positive outcome to the end. It's been 75 years, we've been talking about, and Baba Sahib has written all these things to begin with in the Constitution. After this 75 years of independence, our community is still struggling for the better health, and which is true apathy. Like, we recently have helped the Bahar Foundation in Nagpur, just getting a basic machine to detect the sickle cell anemia. So I think when we are talking about the advancement, we are reaching to the Mars and whatnot. It The ground reality is much different, so, and this is really painful when how our government can be so blindfolded, completely not seeing the problem of society, which is in this, not just like a 1 or 2 crore, it's like a crores of populations, so I think so this is a pure ignorance, and where we as a educated community, I think if not the fully educated eight, I think certain portion who are able to raise the voices, and I kudos to your work, that you are raising this issue as well.
Yep, thank you. Yeah, sickle cell is a very big issue, and I had opportunity to research a little bit about it. But that means I will not take this opportunity to, maybe go on tangent and talk about it maybe some other time. But that is a very sickle cell and other issues, and the coming wave of, I should not say coming, it's already there, but the wave of non-communicable diseases, we need to look into that as well, who are getting affected mostly by that, and and what could be the reasons behind it. Anyways, so we'll move on. Does anybody have any other questions? Manish ji, I know you asked me one personal one question directly. uh, that question is a very broad question, and I cannot answer that in a 1 or 2 minutes time. Maybe that will need a very huge discussion. So maybe we can talk later on that.
Sure, sure.
Yeah. Anyone else has any
Because
question?
everything, every social determinants start from this only. That's why I'm just wondering, are we able to address this issue somewhere?
We will be able
Yeah.
to, and the countries have shown, they can do, they can tackle this issue. In fact, just to give you a brief example, in Europe, whatever improvement in mortality they observed in 18th and 19th century, that wasn't because of having many more hospitals. It was largely because of having better sanitation, improved work condition for communities. And that was all argument of Dr. Ambedkar's was as well, right? So, and that is scientifically proven. What I'm talking about Europe, there are so many papers which talk about, how conditions in Europe improved and sanitation improved in that time period, and how it has helped Europe to reduce mortality overall. Um, so it can be done in recently also. It has been done in other countries, Latin American countries. If you take example of those countries, they specifically focused on poverty and were able to make few advancements. So that is, a short answer to your question. Anyways, do we have any other questions before we? I guess we already passed our time, allotted time. So
So
Just
would it be possible for us to have a follow up talk on this? This today's talk was phenomenal. It was primarily focused on the initiative what uh, Dr. Vaidya is running, as well as Baba Sahib's kind of thoughts and ideas about the health
yeah,
for our masses as well as for the India.
right.
But would it be possible for us to kind of have a follow up session wherein we can hear more about the current challenges, particularly healthcare challenges with our community because of the overall changes, lifestyle changes, as well as the overall kind of approach towards the health.
So
Let
there
that
are
be
so many.
for Indian masses as well as for people who have immigrated to places like US or Europe.
Absolutely. And that is something of my interest is like I work on health insurance problem in US and India as well. How things are shaping up in healthcare financing domain. And there are so many other researchers who are working on nutrition back in India, in some food security. There are so many dimensions of health on which people are working. We'll have to it's a we'll think about that, like how to go, organize more sessions on this, and generate some thinking on that front. Definitely will do. Satyanath ji,
just
briefly, if you can. Yeah, go ahead.
just one small question.
Mhm.
A couple of weeks ago, a young lady, I guess she was doctor or researcher. She's near Washington. She talked about sanitation
Right.
things, and I
Yeah.
had mentioned that we should try to find out um, uh, what needs to be done regarding sanitation. Infrastructure. I have not yet been able to go to the sanitation department here in New York. But if you could also, on your part, being a doctor yourself, could try to find out, that would really be great, because our sanitation thing it seems really so. I mean, here you don't. Nobody has to enter into any tunnel or anything like that. I have not seen anything. So what's we need? We really need to find out and suggest it to the Indian government, federal as well as state level, or even panchayat level, how to deal with the sanitation thing. Okay,
Yeah.
thank you. Thank
Yeah,
you.
sure thing, sure thing. Yeah, definitely. That those things are in our mind, and definitely we'll do that. So I think we'll conclude this session now. I'm really sorry. I know it has generated a lot of interest um, in many folks. So please stay connected for such a interesting sessions organized by Anna in future as well. And you can easily get my details, or Dr. Vaidya, if you can share your email in chat box if you want to connect with us in future as well. Thank you so much. Vaidyaji, I will let you write your email first, and then I will finish the session. Good.
Yeah, I have put in my email already, Dr. Prashit.
Okay, great, great, great. All right then. Okay, thank you so much, Anna. Thank you so much, Vaidyaji. Dr. Manjeet, right?
I
Um,
don't I don't see his email. Maybe I don't know. I don't see it in the chat box.
yeah, Give me 1
I
second.
will
maybe-
put in again.
Yeah, please do.
I still can't see it.
I will copy paste, Pankaj ji. I guess it's your Yahoo email, right? I just put it there. Yeah.
Oh, yeah, I got it. I got it.
Okay. All right. Okay. Thank you so much, everybody. And enjoy your rest of the Sunday. Thank you.